chiropractic is an area of study that focuses on the nervous system, the spine, the joints, and everything that holds it all together. So basically, we have all these joints on our spine, and then there's a lot of ligaments and muscles and tendons that hold everything together. So we as chiropractors work very closely with all of that, mainly focusing on finding those spots that aren't moving properly and helping them do so, but also on a bigger level of helping support the nervous system and getting everything functioning properly. I believe everybody can benefit from chiropractic. If you have a spine and you have joints in your body, you would be a good candidate for chiropractic care. Many people think that you only need to see a chiropractor when you're in pain or you've had an accident, but truly, the benefits are much bigger than just pain relief. Chiropractic works really well to help support the body, to help prevent injury, help enhance play and activity, but also on a bigger level, it can help overall decrease the stress on the nervous system, helping you to sleep better and function better, and get through your day functioning at your best. Here at Vegas Family Chiropractic, we focus on treating people through all ages and stages of life. So from little bitty babies, from just a few days old, all the way up to patients well into their 90s that are trying to keep functioning and keep moving. That includes athletes and pregnant women and older patients and young kids, and really truly nobody that we can't work with here. So many people think that to see a chiropractor, it's really all about the cracking and the popping, but that's 100% not true. While that is an effective option for some people, not always the best approach for everyone. So we do have some alternatives if if we don't think that you're a good candidate for hands-on adjusting, or if you simply just don't prefer the noises or the feeling of that manual adjustment. So one of those is what's called an activator. That's what this little guy here is. And so it sounds kind of funny. It makes a little clicking, but it's extremely gentle. We use this to kind of help get those joints moving and basically disrupt the tissue so that it can help things calm down a little bit. So very comfortable, always a great option. Another great option is what's called drop table adjusting. As you can see here, these little splits in the cushion actually raise up. And we mainly do this with the patient lying face down. And we line up those areas that we need to get some movement in. And we can do a little push. And the great thing about it is the table absorbs all the shock. So it lets us get some good movement within the spine without putting any extra force through the patient and limiting any rotation that we may need. So there's so much more to chiropractic than just the adjustment. While that's an important part, sometimes we need to incorporate some other options into treatment to get the results that we truly desire. So that may include some electrostimulation, some ultrasound, ice or heat, some massage or some muscle work. So we kind of build the ideal plan of what we think the best approach will be for each individual patient. On your first visit, we will go over your medical history and ask you some questions about your chief complaint and what brings you into the office. This will help us kind of get a well-rounded idea of kind of where you're at and where we think we may need to go with treatment. From there, we will do a physical exam. We'll do some basic procedures here in the office just to kind of get a sense of what might be happening, to rule out anything of a serious concern, and help us come to an appropriate diagnosis. From there, we will discuss our findings with you, and together we'll make a plan to figure out how we can get you out of pain or resume your function, whatever it is our goal is. We don't always need an x-ray for a new patient, but if we do find anything in the exam that is of concern, we will recommend x-rays and refer you out for those. Typically, we will begin treatment on that first visit here in the office unless there's anything in the exam that prevents us from doing so. All of your questions will be answered in your visit, and we do our best to make the most appropriate recommendation. When coming for your first visit to our office, we do recommend that you bring a photo ID and any insurance cards, as well as any imaging you may have had done in the past that may be relevant to what we're working on. This gives us a chance to review everything and make the most appropriate diagnosis and recommendations. Additionally, we recommend that you wear something comfortable for your exam because there will be a little bit of movement involved. To schedule an appointment, simply give us a call or visit our website to schedule online. For a more in-depth tutorial on how to schedule online, click the link in the description box below. If you have any more questions that we didn't cover today, please feel free to give us a call or drop by the office and we're happy to help.